Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Salesforce, welcome and thank you for joining us for today's webinar. We're looking forward to a timely discussion on how healthcare marketing leaders are driving innovation with data. In today's world, healthcare marketing leaders must innovate to remain competitive. In this webinar, we'll learn how they're doing just that with the help of data. Our speakers today are Chelsea Lockhart, System Director, Digital Outreach and CRM for Bon Secours Mercy Health, and Ben Seyden, Executive Strategist at Salesforce. They will share how Bon Secours uses data to meet the patient's experience of real-time, personal marketing experiences, which tools and technologies marketers are investing in to support automation, productivity, and real-time intelligence, and more. A couple of notes before we begin. First, if you'd like to ask a question, please enter it into the question and answer pane located at the bottom of your screen at any time. Chelsea and Ben will respond to as many questions as they can in the time we have. Secondly, we will be conducting several audience polls during the program, so please be sure to participate when those pop up on your screen. In fact, we'd like to conduct our first poll now. As you see on your screen, the question is, which of the following best reflects your role at your organization? Please choose from the following responses: marketing and communications, digital marketing or strategy, data and analytics, consumer patient engagement and experience, physician or provider relations, or other. Your responses will provide helpful background for Chelsea and Ben as they share their presentations today. With that, I'll turn the program over to Ben Seyden to kick us off. Ben?
Thanks so much, Daniel. Love the fact that we have a good group of people in the audience today. I figured we would have a lot of MarTech and marketing and communications folks representing. And so I'm really excited. I think that this is going to be a really good use of your time. And I think that this is going to be an exciting opportunity to hear from really one of the best marketers in the healthcare space today. But my name is Ben Seyden, and I have worked in the healthcare space for quite a while, as well as having worked outside of healthcare in other verticals. And I'm super excited to connect with you all today. My role at Salesforce is to kind of talk to executive leaders in the marketing space across the country and encourage them with how they can be proactive in meeting some of the challenges that they're facing with digital technology, but also hearing what they're doing and hearing their stories and being inspired by what some of our incredible partners like Chelsea are doing with the technology that they have implemented at their healthcare system. What we're seeing is that this conversation is more timely today than it probably has ever been. Healthcare systems are really facing turbulent times right now. A significant number of hospital systems posted huge losses in 2022. Hospital margins are down in record numbers. And part of the reason for that is because the increase in labor costs in the healthcare system are $135 billion year over year in 2022. It's harder to get the right people to do the right jobs. And so we're being asked at Salesforce to help marketing organizations do more with less, right? So help us to better automate fantastic patient experiences and do a better job of reaching into these turbulent times with a smaller FTE footprint. And so what we're seeing is that organizations, especially organizations like Bon Secours, who do have that hub and spoke model, are realizing that this stat, the Bain & Company stat, the 30% of primary care volumes will go to non-traditional providers by 2030. they're realizing that they can no longer sit on the sidelines and just kind of talk about doing something. They have to be active. They have to be doing something because of all of the disruption that's coming in the midst of this turbulence, this financial turbulence. So what we're seeing across the nation is that healthcare and life sciences marketing innovators are focusing on a few things. Number one, they're focusing on improving patient acquisition. They're really focusing on that patient acquisition strategy of how they're going to go to market with the messaging. And it's no longer good enough to just say, hey, we've got a billboard up on the interstate. People see us, and since they see us, they will come to us. That's no longer good enough. That's no longer what marketers are doing. And they're running campaigns that are driving high revenue procedures. What I always tell people is, if you can get somebody into the cardiac cath lab, you're basically printing your own money. So if we can be driving procedures that are really high revenue, that's when the marketing department is going to turn from being a cost center to being a revenue center. And that patient acquisition strategy is really what they're focusing on. And they're understanding that the patient lifetime value, regardless of what the patient lifetime value is for your hospital system, like you may have figured it out, much more clearly than this. But in 2017, Medicare said the average lifetime value of a patient was 1.2 million. So I've just rounded up and figured out with some inflation, we're about $1.5 million is the average lifetime value of a patient in the American healthcare system. So we need to be, as marketers, focusing on how are we going to get as much of that $1.5 million into our hospital system as possible. Everything else is side work, right? Like, we've got to be focusing on how we're going to help our hospital system become profitable in the wake of a couple of years of record losses. So they're focusing on improving patient acquisition, and they're also focusing on prioritizing engagement. They're looking beyond the EHR. The EHR does a lot of really good things, but EHRs were never designed for engagement. They were never designed for moving a patient through the process or having a relationship with that patient. So these really innovative organizations are guiding patients through curated journeys. They're saying, look, we know that this is where you are in your journey, and we're going to help you take the next step. We're not just going to expect that you're going to come in for that next visit, or that you're going to know that you should get that next screening. We know who you are. We have petabytes of data about you. And so we're going to actually communicate with you as to who you are as an individual. And we're seeing that with a 5% increase in retention and upsell, you can actually increase your revenue by 25%, which is incredible. What we're seeing is some organizations are saying, look, we know that you're coming in for a PCP appointment. Because we know that, we're going to suggest that you do XYZ while you're here. So we're going to improve the value of that visit. We're going to upsell you. Maybe you should get a flu shot while you're here, or maybe there's a different type of thing that you should have done while you're here. So we're going to upsell. We're going to maximize that visit, not only for the hospital system, but also for the patient, so that they feel like they really had a valuable engagement. So these innovators are focusing on their patient acquisition. They're improving their acquisition. They're prioritizing their engagement, and they're mastering their data. Again, we have huge amounts of data. I talk all the time about how we have petabytes of data. We have Scrooge McDuck levels of data. And we can dive into that data. If you remember Scrooge McDuck diving into his gold coins, but what are we doing with that data, right? How are we using that data to improve patient experiences, improve patient communications, right? Are we building that 360-degree view of who that person is, of what their social determinants are? Can they get to the doctor's office, for example? Are they able to afford their prescriptions? Like, what is it about this person? How can we truly educate them and care for them? How can we organize that data to make sure that they have the best experience possible? And providers should make recommendations, again, for that next step, that next thing that person should be doing in their journey. I think a lot of times what we do is we just assume, yeah, they'll go figure it out. They'll go out to the WebMD and it will tell them, hey, you're 45, you're turning 45, you should get a colonoscopy. Well, that's great, but we need to be the ones, the healthcare providers need to be the ones that are having that communication, because if they get that colonoscopy or whatever type of colon cancer screening that they do, we want to make sure that they're doing it with our hospital. And Chelsea wants to make sure that they're doing it with Bon Secours. So we know that there's huge financial headwinds in the healthcare and life sciences space. Plus, there's a ton of money. Over the last 5 years, venture capital has doubled every year into the healthcare and life sciences space. So not only are we facing difficult, turbulent times financially, but we are facing unprecedented levels of disruption. And we're no longer just looking at the hospital system across the street is the one that you're competing with, but now it's nationwide. You've got nationwide players who are specifically coming after your primary care market. So we have another poll that we're going to ask. And the question is, which of the following is the highest priority for your organization today? So we just mentioned these three things. Is it improving patient acquisition, prioritizing patient engagement, or mastering your data? We'll give you just a couple of moments to weigh in on that. I know that all of these things are going to be a priority for you, of course, but choose the one that you consider the highest priority. All right, well, the answers are in, and we can see improving patient acquisition is the #1 priority of the people who are on our call today, Chelsea. And I know that that is something that you are passionate about and that you are really, really good about. So I'm going to turn it over to Chelsea Lockhart and let her kind of talk through how she is approaching these problems at Bon Secours Mercy.
Yeah, of course. Ben, I love presenting with you because you're always so incredibly complimentary, but absolutely excited to share what we're doing at Bon Secours Mercy Health. So hey, everybody, I'm Chelsea Lockhart. I'm the Assistant Director of Digital Outreach and CRM. And basically what I tell people that means is I'm over all things Marketing Cloud, all things patient outreach, what our patients are getting and how we're engaging with them. I've been fortunate to work in the Salesforce Marketing Cloud ecosystem for going on, I don't know, wow, over 5 years or so, and have really just come to love this space and what people are doing. Love connecting with people on LinkedIn. So if you're in the group, want to talk more about it, be sure to meet me there. I'm also very fortunate to be included in the Salesforce Marketing Champions program, which means I've got a ton of other friends doing the same stuff, going around talking about the gospel of Salesforce Marketing Cloud, if you will, and what it can do for healthcare. Ben is driving for me today. So Ben, if you could take me to the next slide. Okay, so we've all seen these slides before. Sort of gives you an idea of how you can compare my health system to yours. We are basically all across the East Coast of the country, one of the 5 largest Catholic health systems in the country, but one of the 20 largest in the country overall. We've got a lot going on, over 50 hospitals, lots of providers, also some locations in Ireland as well. But if you're anything like me, when you see this, what you really want to see is the next slide, which is what's going on under the hood at Bon Secours Mercy Health, and how does our stack compare to yours? So we are currently running 2 instances of Epic, which are being combined into one. And if you've ever lived through that, I feel for you, but it is where we're at today. I'm very excited to see that come to a close soon. As far as our Salesforce stack, we've got Health Cloud, Marketing Cloud. We're running with Interaction Studio and Datarama, so very well endowed space there for us. We live, and we'll talk about this later, sort of what our team structure looks like and where we sit in the organization. But we live in an IS embedded digital transformation function, so we're not within the marketing department, but very fortunate to have 7 people dedicated to all the work that you'll see today. So yeah, happy to talk later more about that. But Ben, take us along to the next. So just to set up why we're here, as Ben did, I think as healthcare marketers, we have all seen this space change, especially through all of the turbulent times that we're in now. But if we take a look back, maybe 10 years ago, there was this major push to sort of focus on our brand, build a brand. Who are we? What do we want people to feel when they look at us? How do we want people to engage with us? And then fast forward about 5 years or so, and we got really into the world of personas, right? So what do all of our moms want? What matters most to them? What matters to our retirees? What are the real points that are going to make them choose us, help us acquire them? How do we understand these people? And the shift now is that really doesn't matter, because what we need to know is where you are in your health journey, a full personalization of where someone is. If I'm reaching out to you because I think moms care about, primary care appointments, and I already know that you have a primary care provider, it's not as relevant. So that personalization is the real big thing that you need. But if we're all being honest, personalization at that scale is not possible with a tool that's not like Marketing Cloud. So you have to have these technologies in place to make this level of personalization with your data possible. So we will stop here. I always like to get a read. We're going to do a poll. And Daniel, if you could bring that up for us. Okay, so question is, where do you feel like you're at in the automated messaging journey, if you will? How mature do you think your organization is in this level of personalization? A few different options here of just getting out the gate, or all the way to we are messaging ninjas, where we've got it handled. We're just here to spy on what you're doing. Let us know where you're at, and it'll give me an idea of how we can talk more about it. And Daniel, you'll just have to let me know when it looks like we're getting a good number. Okay, I'm going to take that as we got it. Okay, lots of people just getting started or steadily moving forward, which is great. Also, I see you ninjas. I see you out there scouting. Are pretty advanced people. Glad y'all are here all the same. But we'll talk through a few options today of things all the way from you've got it going and you know what to do to my compliance team will never let me do what you're doing. How do you figure it out? We'll talk about it all. So Ben, take us to the next slide. Okay, so this is how we look at what we just talked about. So my real focus of moving to this personalized conversation, the way that my team focused here is that this strategic priority is what we're here to do. We are here to acquire and retain, build that loyalty, and meet people where we are. It's a big statement, but the way that we do that is what we've got here. So mining that data that we have to find those key moments when people are most likely to take actions with us. It's a big statement, again, to say that we're doing this, but this is what really makes your data so valuable and what we really call our secret sauce of how we make it all happen. And on the next slide, we really get into the nuts and bolts of the secret sauce. So when I say we're mining our data to find those moments to reach out to people when we know that they're going to take an action, these are the 3 buckets that we sort of put those moments within. So looking in our data for things like, has someone's relationship with their healthcare provider changed? Were they coming in to see us regularly and all of a sudden they're not? Or have they started seeing a provider and then switched providers? Really just using that to have a relevant conversation. We also look to life events, things like, has someone had a new baby? Is someone reaching a retirement age? Different milestones in people's life when they're likely to care about their healthcare more. We want to be present in those moments. And then finally, look at engagement events. So is someone utilizing online scheduling for the first time? Have they downloaded our app? Do they need help navigating in that space? What's their preference for scheduling? And when we can see those actions happening in our data, How are we present in those moments? So this is the real like big kahuna of what we do and how we make it all happen, but we'll go into some more examples in the following slides. So just to further dive in to the where are you at on your journey, I can sort of tell you where we were and where we are now. So the where we were is here. We were sending, it was painful to remember these days, but we were sending one-off seasonal campaigns. So things like, it's diabetes month. This month we should send something to people who might need to come in for diabetic care. So we were using our data, we were, reaching out to them, doing something annually. It would really come down from, hey, this is a target group for us. It would help our metrics to be able to reach out to them, and we would do it. Where today we can show, now it's a lot more patient-driven and a lot more personalization-driven. So rather than these campaigns that run during diabetes month, we've got something that runs every day of the year. And you can see here this example of it's time to schedule your annual checkup. This runs every day of the year. And what happens is the query in the campaign is looking for people daily who might be overdue. And as they become overdue and it's most timely and relevant to them, we are sending them this information. And what we've seen there is a huge lift from that. So next slide, we'll get into some real depths of like how we do this, what the data required to make this transition look like is. So again, I've said it before, a huge fan of Marketing Cloud over here. This is where we make it all happen. But what we brought into Marketing Cloud to do this is, of course, our patient demographics, we brought our Epic records in. So looking at their past and future appointments. Our call center is also based in the Salesforce ecosystem. So when someone is calling and having an engagement with a call center representative, we're seeing their needs and we're tracking those interactions. As people are interacting with our marketing campaigns, filling out forms, for example, we're tracking those. And then we're also using the Salesforce ecosystem to track the downstream impact from all of these things. So excited to show you guys sort of how these campaigns function on the next slide. So here's an example of a campaign that we run, and I'll say that this is what a lot of our campaigns look like. So take the topic here and swap in for what you will. This is a primary care campaign. You could think of mammography, you could think of colorectal cancer. We've got a lot of them running for basically all of those health maintenance topics. But the idea is that someone is overdue for their annual care visit. They get an email from us first. We try and send them an email. And then we're waiting to see if they open that email or if they don't open that email. If they don't open that email, we're going to go to step 2. Or if they never had an email on file, we'll just start at step 2. And we'll either send them an automated phone call with, hey, it's time to call your doctor, or a text message that says, hey, time to come in for this thing. If they don't take this action, or they open the email and also don't take the action that we're wanting, we are reaching back out to them every 6 months to say, hey, it's still time for you to do this. We're re-entering them in this flow. And like I said, this is running every single day. So we try and think at every step, how would we function as patients? Where would we need the reminder? And really get that personalization of the actions that they're taking at every move. So the next slide is another example of something that's a little bit more loyalty based instead of that sort of acquisition or you're overdue. We really focus on a new patient welcome journey as well. So this is a multi-phase journey where if you're a new patient to us, we'll email you after your visit and say, here's our app. Thanks for coming in. Our app's going to make things easier for you. A week later, we're reaching out about, do you have other care needs? Here's other physicians that we may have for you across specialties. And then the last thing that we do a week later is here's all the different access points you may need from us. So things like urgent care or virtual care or the emergency room. And what I love about this journey is I think as healthcare marketers, we'll often have, I love to pick on urgent care, but they'll come to us and say, hey, I really need an urgent care email. And the thing about urgent care and email is I'm never going to know based on somebody's data when they're going to need urgent care. So it doesn't become a timely or a relevant message to my patients. But as I'm introducing patients to the health system, it's a really timely and relevant time to tell them, what we've got for them and how we may need it. So including that message here makes a lot more sense than a standalone random email about urgent care. And that's how we like to think about our strategies. So the next slide shows how we take it a step further as well. So the other thing that we've done at Bon Secours Mercy Health that we're really proud of is all of our appointment reminders, confirmations, for pre-check reminders are all coming out of the Salesforce ecosystem. So that means that when people are, subscribing or unsubscribing, they're sort of managing all of their communications in one fell swoop, which is a really great patient user experience for us. So you can see here sort of the flow of this journey that we have. It's very thorough and we optimize it all the time. But if someone is scheduling less than 4 days, they'll get a couple of check-ins from us before that appointment. Through these channels, they only get one, but it's the one that they prefer. If they're scheduling more than 4 days out, they get a few more check-ins from us along the way, a few more pushes to confirm. And again, they're just getting the channel that they prefer most. So this was really our crowning glory to kick off our marketing cloud journey, but it's really paid off for us and really built that reputation for us with our patients. So on the next slide here, you can see is the juice worth the squeeze? Was doing all of this work to make this major transformation worth it. I know that it takes a lot to do this and very costly and huge efforts across the team to do it, but I can say that it really has paid off for us. So as we've reached out to patients and really focused on that timeliness and relevance, we're up to a 30% appointment scheduling conversion rate. And I dare you to find me another way that you're able to do that without this technology. It's amazing. We've driven over 10,000 downloads to our app. We're seeing really strong open rates, which I know are a little tricky these days, but I still love them. And really have included a ton of patients in this messaging. So hope that these numbers are encouraging to you if you're on this journey or just starting out on it, that it really is worth it. So on the next slide, we will talk a little bit more about what to do if you're really, really early on the journey and you haven't quite gotten there, you're getting a lot of pushback. Here are some of the things I've heard on my way and my team has gotten through that I love to share this wisdom. So something we hear a lot is my clients want what they want. For example, urgent care. People may laugh and say, cute that you can tell urgent care I'm going to put them in a new patient welcome journey. I just have to send my emails to urgent care. They'll never have it. I think the more you can explain to people the benefits of pushing from that siloed conversation to that orchestrated conversation, you can really shift their minds because they understand it as consumers themselves. So don't give up on that one. And then the next one here is doctors don't want us playing doctor. And we hear that all the time. So who are you, Kelsey, in digital transformation to know when my patient needs to go to primary care or when my patient needs a mammogram, for example? And the answer is that I'm nobody. I don't know these things, but we do work with a team and a committee of clinicians to help make those decisions. So every time we launch a campaign, we're bringing it, to a steering committee that's helped with clinicians, helping us decide, do you love this criteria? Do you like this timing? Is everyone on board for what we're doing? So by removing them in the process, you really remove that doubt. The next one here is it's operationally better for us to do this. This is probably my favorite one to get over and my favorite one to surmount, but things like, for example, scheduling a mammogram can be tricky in some health systems. Sometimes you need to have an order in place. Sometimes you have to call your doctor to get that order and you can't just open schedule that. We have to really start looking at the patient experience of that and pushing out those roadblocks as we can. So should we only be reaching out to patients, who have these orders, or should we, remove that barrier for them, for example? So really considering you as your own consumer and pushing people to do that. If you got an email that told you schedule your mammogram and you then had to call and get the order, you'd be very frustrated. So really pushing to change people's minds through their own expectations is a recommendation there. And then the last one, love this one, I'm sure Ben does too, is our legal team is very conservative. So how did you get a yes on sending any of this? Is this not all private or protected information? And I'll say you've really got to build the relationships there with your legal and compliance teams, because all of these things that they're giving you are opinions. And you'll notice that health systems across the country get different answers on these different things that they're attempting to do. So really helping them to see, is this benefiting the patient? Are we using the minimally viable amount of data to send these out? and helping them see the benefits there and truly understand the technology is where we've gotten the furthest. Great. So in the next slides, I promise also for people who are even further at the beginning of the journey and saying, look, I'm not to these sophisticated personalization techniques yet. What can I do in the meantime? Here are some of the basics that I encourage people to just focus on. Things like that timeliness and that relevance. So if you can find a way to make that urgent care email go at a time that makes sense, like a flu season or a school physical season or something like that, lean on that timeliness and relevance as much as you can. We're also huge proponents of A/B testing, seeing what's mattering to people, great tools in Marketing Cloud to do that. We are ruthless about what we send out when it comes to engagement and deliverability. So if we're seeing low engagement or seeing low deliverability, we're going to change what we're doing and really shake up what's going in there. Same with meaningful clicks in our email templates. So if we're not driving people to the links we're wanting, we're getting all of these ancillary things, we're really going to focus on those key CTAs that we're wanting people to take. Right. So next here, we're coming to the close. And people are always curious about, how is your team structured? Where do you sit? How are you guys aligned? And I love to go through these slides to just, give you guys that little bite of the curiosity there. But essentially, my team sits within a digital product structure within a sort of IT digital transformation arm of the company. And you can see here, these are my peers, essentially. So we're sitting alongside a Health Cloud team that's really focused on those call center interactions. We have a web and search team that we're with, digital front door and app, sort of the integration pieces of the people carrying data to and fro to make all of this happen. And then you've got marketing automation. And I'll say I've had the privilege of working at companies that have that Marketing Cloud teams within marketing, and I've had the privilege of doing this as well. I think the benefit here is that you're alongside peers that sort of really understand the marketing technology space and really understand, I'm having trouble with this Epic feed is a very different conversation from these people than traditional marketers. However, traditional marketers really understand, what the actions are that you're trying to do in Marketing Cloud. So there's no perfect way to do it, but this is our example of it. And then in the next slide, you can see sort of what our marketing automation arm really taxed ourselves to be focused with. So these are sort of our 4 pillars. And the big one is that outreach campaign development that we talked about today. So we're very focused on, engaging with our patient, closing care gaps. We're also super focused on the architecture of the data that comes to us to be able to power all of that. We, of course, then have to report out on all of the things that we've done and are they impactful and did they make a difference? And then we always have our eyes to the horizon of what new technologies are coming up. Things like Interaction Studio, how can we personalize in a stronger and even better way? So these are really what make up our priority projects within our area. And the next slide really dives into who's on the team and what roles do we use to make it happen. So we've got myself, who's really leading the strategy for the entire arm, a campaign strategist who's focused on what are the opportunities within the company? What do we need right now from a business perspective of care gaps closing or engagement points? If we want people into the cath lab, like Ben was talking to earlier, what's the beginning point of that journey that leads people to the cath lab that we can track their data and drive them to? We then, of course, need someone really focused on segmentation within our data to find those people, utilizing SQL queries to pull them out within Marketing Cloud and designing those automations and the flows that we talked about of they get an email and then they get a text and all of that. Someone's got to build that. Then there's also an architect that's focused on all of the data being in place for our segmentation manager to be able to function with our different technologies of how we see things from the call center, how we tie into these different spaces that we have. And we've been very fortunate to have experts in the email design space really focused on that deliverability, driving those clicks, reputation, the whole world within itself. And I'm very lucky to have some assistance there with a specialist who's also very focused on that entire appointment reminder journey that we talked about today. And then you've got to quality assure all of this. This is very important, very technical stuff, and especially being in an innovation space where people don't always necessarily trust what you're doing or fully understand it. You want it to go right. So QA is a huge element for us in everything that we do. And we are very lucky to have had Accenture along the ride with us for implementation and then for special projects along the way. So this is what our team looks like. If I'm right, I think that brings us to the end here. No, that was a ton, but I want to throw it out to y'all. If anybody's got any questions, please just type them in.
Yeah, we've got a few coming in. So we'll just kind of work through the list, if you don't mind, Chelsea.
Sure.
And we'll just sort of do a little jam session. Chelsea is a big jazz fan, so I know she was at the Jazz Fest there in New Orleans the last couple weekends. So
yeah.
Here we go. Jam session for you, Chelsea. First question.
Okay.
Have all of these patients opted in to receiving messages? And then there's a follow-up as well. How do you, what does your preference center look like, and how was that built and that kind of stuff?
Yes, love this question. You bet your bottom dollar they have all opted in. And if anyone from legal is on the call, I can show you the receipts that they have done it. We have a universal consent document that patients sign upon their first appointment, which gives us the consent to be able to reach out to you through these channels. Upon your creation as a patient, preferences get automatically added for a multitude of channels that you're able to either go into Epic or our Marketing Cloud Preference Center to change. Love the question about the Preference Center because those can be a real headache. We have a combined Preference Center. So if you make changes to your preferences in Epic, they're going to change your preferences within Marketing Cloud and vice versa. We manage two separate sets of preferences. So one for what we call patient outreach, things like those care gap closing campaigns, that new patient welcome that you saw, and one specifically for appointment reminders. So if someone gets really frustrated and wants out of patient outreach, they're still going to get their appointment reminders. It is a very complicated mess, but I'm very proud of what we have.
What tool do you use for that?
Marketing Cloud. It's all custom work within Marketing Cloud.
Very cool. So Krista asks this question: is the SMS option built into Marketing Cloud, or do you use an integrated tool to send the SMS? I know the answer to that, but I will let you answer.
Yeah, it is built into Marketing Cloud, and we also manage a double opt-in through Marketing Cloud as well. So even if you check, yes, I want those text messages, you've got to text back yes that you're willing to opt into our texting, and we consider that as well.
Perfect. And another Chelsea, great name, asked for the welcome campaign, and I would imagine that this is welcome and any campaign. Is it only email based? Do you have any other direct mail components as well? So, for example, I know that like a lung scan, if you're in that lung scan group, you have, the hospital system has a responsibility to communicate that with you. So if you don't respond to email, you have to send a letter, right? So like, how do you do that? Do you have some way of that being combined into your system and your setup?
Yeah, unfortunately, it's a little bit of a black hole for us there. So the new patient welcome campaign we mentioned, that one is exclusively email communication. The other campaigns we talked about today are email, text message, and phone call. So an automated phone call that goes out to you. There's a whole black hole of the health system that also sends reminder letters to people as they're needed for things like what you're talking about, Ben. That is not coordinated at this time, but it is on our list to try and figure out, how those things are happening, what their deployment schedule is. We have made calls, like for example, our Epic team uses Epic Radiant to reach out to people about mammography in a very persistent way. So they send MyChart messages, they send physical letters, a series and a sequence of things. And we made the call that maybe it doesn't make the most sense for us to send emails, text messages, and phone calls on top of that. So we are having these conversations to make sure that we're coordinated there, but it's not necessarily all tied together.
Yeah, and I would just add to that there are opportunities. So we do have partners who you can partner with, who will automatically send that information out for you. I don't know if they'll sign a BAA, for example, but I do know that that they will send out any number of things. They'll send out a koozie or whatever that, or just a letter. But another option that you can have if you need to have a letter sent is you can have your call center team, your Health Cloud team, get an alert that, hey, we need to print this letter and send it. And that can be triggered by the Marketing Cloud journey for sure.
Yeah, very similarly, Ben. And I can say from my previous experience at my last health system, we did have direct mail integrations within journeys. It's very similar to what you're talking about. It's essentially daily as these campaigns are running, people are getting added to a list that we need to mail things out to them. That is going to an FTP that's then getting picked up by a printer that we had an established relationship with and all the BAAs and everything in place with them. And they knew if a file has this name, drop this monthly to these people. So it can definitely be done.
Yep. Awesome. That's great. So another question here, what is your internal data management like? Do you have a lot of support from the data teams? It looks like you're part of the data team, really. But how are you flowing the data from the EHR ultimately into Marketing Cloud? And another question that was lower down the list is, how did you choose what data to flow in? So that might be this might be a good time to answer that too.
Yeah, those are great together. I love this question because everybody does it differently. So just keep that in mind, that it can be done in so many different ways. I've seen it to where all the data goes into Health Cloud and you make decisions about what goes there and it comes over cleanly to Marketing Cloud. That's not the decision that we made here at Bon Secours Mercy. So the way we have it is that certain information, think things that a call center agent would need, go into that Health Cloud space. So patient demographics, a few key things about past appointments, but not all of that information is necessarily like persisted there. They'll have a view within Health Cloud of that Epic record, but it's not saved there. And we all know that that storage can be expensive, and that's why those decisions were made. To get the rest of this data, like when was this person's last cervical cancer screening, or when was this person's last, whatever it may be, we are getting those directly in Clarity extracts coming directly into Marketing Cloud. So we're sort of being fed from a couple of different areas. And all of that is, we utilize Azure to get the pipelines to get that in. Some other things are run through MuleSoft, for example. It's a very messy data structure, but it definitely works and serves the needs that we have for it. I think on our dream list is a product like, Ben, you gotta help me, it used to be called CDP, and now it's called Data Cloud.
Yep.
Data Cloud is on our sort of future dream list of maybe something that could clean all this up for us and make it a little bit simpler. But yeah, again, can be done in so many different ways. Ours is sort of coming from all over the place. As far as making those decisions, selfishly from the marketing side, I'd say get as much as you can, as much as they let you have. Feed that into Marketing Cloud because you're not hit with that storage as much in Marketing Cloud. But look at the campaigns you want to run, your dream state, and think about what you would need to incorporate in those queries to do that. So what different fields do you need to make that happen? Sort of work backwards that way is the best advice I have.
Yeah, and I love that answer. I would say too, we're seeing some other organizations who do have that data cloud that are doing some of those things like what you were talking about, that moving somebody from being an urgent care only patient to being a primary care patient. And the great thing about that data cloud type of a platform is, you also mentioned it earlier with your HIPAA conversation. HIPAA requires that people have the minimum amount of access to that data. So if you can have the data stored in a HIPAA compliant platform and your team doesn't even actually have to see it, right? Your team just says, hey, go find people who meet these criteria, and there's 120 different pieces in the criteria, right? Then you have, that's another step that you have taken to make sure that you are HIPAA compliant and that you don't have any of those those breaches. So yeah, really, really cool to be able to do some of those things in a HIPAA compliant manner, but also at scale, because really at scale is the hard piece. I remember when I was in your shoes, I would ask for a report from our IT group, and it would take literally 60 to 90 days for me to get a report about app usage. And by the time I got the report, they ran it to the date that I had requested the report. So now it's 90 days old. So what's been happening in the last 90 days? Oh, well, you got to submit another report.
Yeah.
And
yeah.
where you need to be able to do it real time.
Right. Someone asked about the level of support that we get. That reminded me, we get a fair amount of support from our peers in, the Epic teams and Clarity teams to do that. But like Ben is saying, we do run into examples where those people's time is finite. And so the more data we have access to on our end, we try and be as minimally reliant on them as possible.
Yeah, perfect. So here's another question. What tool do you use to offer patients the option to digitally register prior to their appointments? Can they register several days prior?
Yep. Yeah, that is Epic. It's an Epic functionality. And so what we're doing is I think people changed the name of it. It's basically the pre-check within Epic. We just offer up sort of the links to get people embedded to do that, and sort of, recommend that as something an action that they take prior to their appointment. So it's all Epic.
Yeah. I think that answers the next one. Do we have a digital registration platform? I think that one's answered. How do you collect patient feedback throughout the journeys, throughout the campaigns? Are you combining these efforts with regulatory surveys like CAPS or HCAPS?
Oh, yeah. So we don't do that at this time. And if by feedback, they're meaning like experience, that's something that we're not doing. But we do look in our journeys for actions that they take. So the journeys are built to sort of reference what someone has done. So after that email step, there's a check for, was this email opened or unopened? There's sort of a block within Journey Builder that helps us do that. There's then sort of feeding into like, there's a check again of like, did they schedule this thing that I asked them to do? And it sort of feeds of branches off of these decisions that they've made. So we consider sort of their real-time feedback of the action that they're doing. Things like patient experience feedback, we haven't quite gotten there yet.
Yeah. And I think feedback is important, but you can also, like you said, you can see how they're interacting with your content. Right. Are they opting out, or what's going on? So that can also help you to maximize your journey. Another question was asked. Now you have an app. Did you use Salesforce for that app, or is that something else?
We did not use Salesforce for the app. It's sort of a custom development app that really brings in a lot of that Epic functionality to it. It does talk to Salesforce, and we made very sure that it does. So if you change your preferences in our app, it sort of works in that whole preference ecosystem that we talked about before. And we do consider, who has these app IDs, which we tie all of that together in the Salesforce ecosystem. So it's all working harmoniously, but it's not a Salesforce product.
And there are Salesforce products that can help you with that, for sure. But yes, you do not have that part of the platform.
Right.
So Lindsay's asking a couple questions. For patient acquisition, are you using claims data?
I love claims data, but no, we're not using claims data. What the tricky part with claims data is it's usually pretty old, right? So it's hard to see, who's taken what action. It's also usually not, in the times I've had it before, it's not really integrated into a way that I can query off of it or sort of build lists off of it within my Salesforce ecosystem. So it's use it with a grain of salt, I guess, is the thing. You can see from the campaigns that I've showed today that we really focus on that sort of like cross-service acquisition at this point, more than like you're a brand new person and I'm getting you in. And it's really, we're using like current diagnosis codes, current, procedural codes, like those sort of things that live within Epic rather than those claims data codes. For things like leads, and reaching out to new people, that's more people who have like filled out a form, told us that they like wanted more information, and we're really just following up there. So haven't had a super big need for it, but have like loved diving into it in the past. So I definitely understand where they're coming from there.
Yeah, we always thought claims data was more directional. It gives us an idea of, what's happening in our market, and that kind of thing. But Lindsay also wanted to know, speaking of that data and that understanding of not just claims data, but all your data, where does analytics sit within your team structure? I don't recall if you have.
Oh, yeah. Yeah, I don't know if I had a whole call out for it. It's basically, they're a peer of mine that helps support all of those different sort of channels that we've talked about. So the ECC, our Enterprise Contact Center, and the Health Cloud team and our app team are all supported by a combined analytics function. And we work hand in hand with them. Go back one more after that. Yeah. So I left them out here, sorry to the analytics team, but they sit in here with us and really support all of these different things. But they know exactly what we're looking for, work hand in hand as we set up campaigns to say, like, this is the goal. How do we show that it closed? How do we pull revenue down from this? And they're the ones really making all that happen for us.
Yeah, perfect. And then you had talked about MuleSoft. So you have an HL7 Fire with MuleSoft, right? So how often are you getting information from Epic so that you can get those campaigns moving in the right direction?
Sure. So my answer is probably the same as I think a lot of people's answers, which some things come over in real time all the time. And a lot of that is things that like call center agents would be. Can't think of the specific pieces off the top of my head, but like some things come over in real time.
Yeah.
A lot of things come over, a few times a day. Some things come over nightly. And when we really looked at these campaigns, we always have to consider, like, would you really need this data? Like, do you really need this data to come over every 5 minutes? Or are you just launching this campaign every day at 9 a.m.? And so if it's all there by 9 a.m., you're good. So that's sort of how we consider when we need data to move and how it should function.
Yeah, that's good. What tools, processes, et cetera, are you using to join various data points to help create personas that drive marketing segments and automate those journeys? And then how are you leveraging that data to report on the effectiveness the campaign is having, ultimately getting to a return on investment?
Yeah. So I'll say we're not like segment people in the sense of like traditional marketing segments. So we're not like, here's our group of, retired people and sort of how they're performing. In the campaigns, we tie together all of the data is sort of fed into Marketing Cloud within different data extension tables. And we sort of are joining all of that together using really sophisticated SQL queries that then say, this is our audience, and then putting these people into this campaign. The way we're tracking, like, did they do what we wanted them to do, is that we're then marrying up, like, here's all the people who got this campaign, and here's all of their activity from an encounter or an appointment scheduling perspective after this campaign. Doing a really sophisticated analysis there of, does anything there match up the goal that we were looking for? So like, we sent this thing to Chelsea, asking her to do this. Here's Chelsea's appointment history and her appointments going forward, her encounters going forward. Did she do this thing we asked her to do? And then there's, of course, those revenue calculations of what's the contribution margin of a visit to this service line? What is the finance accepted number of how much this is actually worth to us, and doing those calculations there. So in layman's terms, that's how we're making it all happen. From a tool perspective, a lot of that heavy lift is coming from Marketing Cloud, also just the analytics team in Excel, pulling in like clarity extracts and things from Epic. We're trying to move that into the Tableau space to really bring all that analytics and calculations lift there. We do some work within the Datarama platform, but at this point, it's not as much encounter-based or appointment-based, just due to the sheer size of that data. It can definitely be done there. It's just a call that we made.
Yeah. And there are a lot of questions. I don't know that we're going to get to all of them. They just keep coming in, which is fantastic. If you don't get the answer that that you're looking for, reach out to Chelsea or myself, and we'll be happy through
Yeah.
LinkedIn. We'll be happy to help you. This is one I really would love for you to speak to, though. How did you get IT over the Epic can do this, and so we don't need somebody else, because
I
you
love
get that
the
all the
quote
time.
of like, yes, so like, we're not gonna remake Epic. Don't you dare try to remake Epic in this thing. I get it. I think it all goes back to what Ben was saying earlier, that like Epic was not designed to do these journeys. And they've come out with their new tools and their new, like, you can message people and do these things. It's never gonna look like what we're doing. So it's not gonna be these like really sophisticated templates with dynamic content that, like, if someone lives in this zip code, show them that. If someone's here, show them that. You're not gonna get that. And furthermore, to my knowledge, that journey technology of like, did this person open this thing? And like, did they click on this thing and check to see if they went to the appointment after they got the thing, and don't send it to them if they did that. I think we're a far cry away from something like that in the solutions that Epic offers. And I think we will be for a long time. So like, you want best-in-class personalization and marketing, you need best-in-class tools to do it. So, if you're trying to spin up something really big, you wouldn't say, here's a subpar thing to make it happen. So starting from, having what you need to do it is a huge leap there. I think also, like, I do hear that all the time of like, I'm not going to recreate Epic from a data perspective, like quit trying to make a mini Epic for you. But by winning this argument of like, look, a my chart message is really different from what I showed today of all of these different things. And, this email is king, not an email that says you have a message in my chart type thing. So that's helped me along the way, but I've fortunately been able to come into organizations that like are really already bought in on this game. So that's been less of a battle for me.
Yeah, we just had the Kentucky Derby this weekend, right? And you want a thoroughbred to do what you're needing it to do, right? So Epic may be really good at some things, but it's not as good at this relationship management and the automated messaging. There's one more question. I think we've got time for one more. And somebody asked, are you storing PHI in Marketing Cloud? I believe the answer would be yes. But then this question, this question is, does your privacy team require field level encryption of PHI in Marketing Cloud? And then if yes or no, how do you have enough data visibility to automate journeys while complying with HIPAA concerns?
Ben, I always think I've got it bad. And then I get questions like this and I'm like, maybe I don't have it that bad. No, my really tough legal and compliance team does not require field level encryption. And I have all the data that I need within Marketing Cloud. I can sort of see and query off of everything I want. I think it comes down to like, it's a HIPAA compliant platform, right? And my team is using it in a HIPAA compliant way. We've got BAAs, we've got, safety agreements with everybody, and it's a trusted tool. So no, we haven't run into like that level of scrutiny. I do get scrutiny around like, what are you putting in this email? Like, make sure it's not a ton. Never say like, how's your diabetes doing? Come to the doctor. It's always like, we offer diabetes care or something like that. But no, like, I'm allowed to have the access of the level of data that I need to do the types of queries that we're talking about.
Yeah, that's great. And we have, so for Marketing Cloud, you have encryption of data in transit that comes out of the box, which means that data is going to be delivered to the recipient in an encrypted format. And then we have encryption of data at rest that you can use, you can add in. But those are the industry standards for both healthcare and life sciences and financial services. So those are normally the right place to get to. Well, with that, I think we've come to the end of our time. So I will turn it back over to Daniel. But before I do, I just want to thank everybody on behalf of Salesforce for coming out. Thank you for all that you do, being on the front lines of the healthcare world that we live in. And Thank you to Chelsea for being an absolutely incredible marketer and incredible partner and even better friend. So thank you so much. And Daniel, I'll turn it back over to you.
Thank you so much, Ben. I'm sure the audience joins me in thanking you and Chelsea for that terrific presentation and answering all those terrific questions. And to all of you in our audience, thank you for taking the time to join us today. Please note that if you asked a question that we weren't able to get to, we'll do our best to get a response to you. We'll also be sending out a link to the webinar recording, so watch out for that within the next few days. That concludes today's program. We hope to see you at a future forum webinar. Please visit the forum website, healthcarestrategy.com, to view the upcoming schedule. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.